The Community Forum came into being in April 2013 as the CCG Community Forum. Prior to that, we'd kind of been leading up to that, having been involved in specific geographic locality area groups, and then they transformed into the Community Forum.
One of the things has been a fundamental principle of the establishment of our CCG has been the concept of triangles. It's been about clinical leadership with community support and challenge alongside with managerial facilitation. And people have really bought into that concept, and we've tried to embed it through the business of the whole organisation. But it hasn't been without its challenges because it comes with a completely different way of working.
We created a structure called the triangles. And to me, the triangles are the absolute bedrock of the CCG strategy, of our values. Because what they do is take important decision-making areas for the future of the health of this area, things like unplanned care or mental health and disabilities, and they bring together three key people to make those decisions or to innovate in those areas. Those three key people are experienced senior managers from the NHS, because they're very valuable people. The clinicians who are involved right at the forefront, because we're a clinically led organisation, so GPs, local GPs, but also, and probably most importantly to me, members of the community.
So our challenge was to build on the strengths that we had seen in the past, but to do that in a way that showed a very real difference, a very membership-driven approach, with our GP members being the driving force, if you like, of our organisation. But we also wanted to build a new culture, and a lot of that new culture was about the balance between clinical leadership, the managerial support to that, and really importantly, the involvement of the lay member, the public, in how we worked in a very tangible way, right in the heart of what we were doing.
My role is very much across health and social care, and that different ethos about how do we start to work to move away from a dependency culture to how do we support people to achieve the best for themselves, for me is really exciting. I think we're only at the start of that journey, but at least we're having the conversations.
So there are a number of conversations between the two organisations around doing things a little bit differently and trying to work towards a more integrated model. We've got a huge amount of health inequalities, but when we unpicked that, a lot of that wasn't down to a medical intervention, a lot of that was around the social side. So we felt that actually by integrating the health and social care together, we could have a holistic solution rather than just a medical or a social care solution that wasn't making the difference we wanted.
As with any big organisation, there's a whole different language that we didn't have. That we've had to come to terms with, and the managers and the clinicians have had to, if you like, temper their own language so that they recognise that it's in understandable English.
If we take the example of our triangles, because we wanted to balance up the input of the manager, the clinician, and the person who represented or came from the community, we would have one of each of those individuals coming together to look at a particular service area, to form a triangle. Not a sexy term, we never came up with a much better word for that. So our triangles are really core to the way that we work, and these evolved in the early days through an initial set of thinking that we did around what they would look like, how they might work, what each individual would bring and what their role would be. But it became apparent about 9 months to a year down track that they were developing very differently, that we're getting different feedback from different triangles about how they were working, and that different individuals were more or less comfortable with how they were developing. And we felt that we needed to come to a more common view about what should be the same in each of them, what should be different, what allowable differences, what were helpful differences to allow to happen, and make sure that everyone was really clear about what they were there to do and how they would work.
When Joanne Hewson, who's the Director of People and Communities at the local authority, was appointed, we met very early on. Immediately said we wanted to have an open and honest relationship. We then started to pick up on some specific issues that we were facing jointly, and there was a particular issue around children's services at the time, and we identified a gap in the commissioning structure that we had in place. So we jointly agreed to fund a post that would work across both the CCG and the local authority. And as part of that conversation, we came out and said, well, actually, both of us are joint appointments, so I see myself as part of the council and part of the way that they discharge their responsibilities through me, and Joanne, in the same way, she sees herself very much as part of the CCG in the work that she's doing in relation to children's services, etc.
We have a joint transitions team now across children and adults, because what we were finding is that we were planning for the children with learning disabilities, and making decisions for them up to 16, and in some cases that could conflict with what they would be going into in adult services.
And all of us felt that we had such a strong grounding and strong basis from the work that had been done before and the relationships we'd built over 5 years, that we could do that internally, we could take that forward ourselves. So we've been using a workshop type of approach. We've been bringing together our senior leaders from each organisation to think about, well, what's the difference we want now? What's the further stretch we're going to take forward?
We've developed between us almost a culture of we are both of both organisations, and so I attend with Joanne the portfolio holder briefing, so I don't brief Joanne and then she briefs the portfolio holder. We just sit in a room together and we jointly discuss the issues and agree ways forward.
We started to bring in some external facilitation to start to learn the lessons, to challenge the individuals, the triangle working arrangements themselves, and start to say, well, what are the lessons of this? What's been working well? How can we transfer the lessons to the other parts of the organisation so that we're much more systemic in our approach? I wouldn't say we've got it completely perfect yet, but we're starting to make some good inroads.
So an example of something we did that we took a triangle is the concept of having a GP and A&E. I think the reason that we were able to get that off the ground was my relationships with my secondary care colleagues and having conversations with them informally, whereas before I think it would have been difficult to penetrate the barriers that were in place between primary and secondary care.
I think one of the main things is a real recognition that when you bring health and care services closer together, it changes the approach and style that you use to all care services. So for me personally, I've had huge value from almost becoming immersed in the culture and the style and the approach of care, as opposed to the distinctions between social care and health care.
I would recommend working in this way. It's been hugely beneficial to improve my knowledge, my understanding of the health sector, and it's really helped me do my job more effectively.
And I do think it's worked extremely well, certainly in unscheduled care. The projects that we've had have been able to not only streamline services so that they're better as far as the CCG are concerned, they've made improvements in efficiency and effectiveness, but also they have actually made a difference to the community. So, for example, waiting times in A&E have been cut down.
So when we were forming the triangles, it was useful to have organisational development. That's the managerial speak, I call it counselling. It's a good opportunity to allow ourselves to reflect with external review, and I found that very useful.
So what we decided was that we needed to plan together as two organisations.
And I've met managers here who have been completely reawakened by the passion that they've seen in those other two groups and the drive that they have to make sure that this works. The CCG shares an ambition to be real and to deliver, and everyone just gets behind that. And I have to say it's been a massive learning curve for me as a lay chair to see that in action.